Hi, it's Paddy from All Care Physio. I'm here with our fabulous new physio, Jess, and we're going to talk about a topic that we have in our latest newsletter, which is women's health, and particularly pelvic floor function or dysfunction. So Jess, do you mind if I just ask you a couple of questions about pelvic floor? What issues do you normally see with the pelvic floor, both in females and also in males?
And males as well, yeah. So a lot of the time we see people who suffer from different problems with incontinence, so urinary or fecal incontinence. So that can be men and women, especially men post prostatectomy surgeries. And you can also have women who have issues with pelvic floor postpartum, so post giving birth, as well as post-menopause, and yeah, a few other issues around those areas with those kind of things.
Great. So when it comes to your skill is basically looking at the pelvic floor, both in females and males. So when it comes to assessing properly the pelvic floor, and if there is a problem doing retraining, can you just talk a little bit about what an assessment entails?
Yeah, for sure. So because of my special training with women's health and the pelvic floor, usually when people come to me with an issue, I do have to see it. So I have to assess the issue properly. If you came to us with a shoulder injury, you'd want us to look at your shoulder. So if you come with a pelvic floor issue, I do have to look at the pelvic floor. So we do internal examinations in a very private professional setting. We can also do assessments via real-time ultrasound as well if you're not comfortable with the internal examination. And there's other various ways of assessing as well, but that will usually be what a consultation or an assessment involves at the beginning, to assess really what is going on and what muscles are affected, so that we can create a good treatment plan from there.
Excellent. So basically pinpointing the problem exactly, and as Jess said, it's a very private consultation, one-on-one, in one of our closed rooms. So in regards to treatment, obviously exercises specifically for the pelvic floor. Can you just talk about what generally, particularly like people who are postpartum, who may have some issues with stress, incontinence, etc. Just if you can talk a little bit about what that entails.
Sometimes getting the exact feeling of what a proper pelvic floor muscle contraction is really important, and that's the first step of training someone to do a correct contraction is probably the hardest part sometimes, especially if you do have a little bit of muscle damage and nerve damage after giving birth. But once you get the hang of that, we do really work on exercises to really strengthen and improve the power, so that when you do activities that are causing leakage or any issues, then you have the strength behind you with your pelvic floor to be able to do those things.
Excellent. So following up from what we talked about today, we have a great special. If you have some problems with your pelvic floor that you want addressed in a very private one-on-one consultation with Jess, then we have a special to the end of July, which is an extended consult, which is 1 hour with Jess to do an appropriate assessment, put you on the right track in regards of exercises, and talk about obviously general advice that goes along with this condition as well. So if you want to take up our offer, please give the practice a call. This won't be on our online booking, 1300 291 133. Book in today and Jess will help you get better in this direction. Thank you.
Thank you.